You unlock this door with the key of imagination. Beyond it is another dimension. A dimension of sound. A dimension of sight. A dimension of mind. You're moving into a land of both shadow and substance, of things and ideas. You've just crossed over into
the Paramedic Zone.
Welcome. What you're about to see is a story based on true events, where 3 EMS providers' worst fears become reality. Now, in the world of paramedicine, nothing is as it seems. There is always more than meets the eye. The date, August 30th, 1995. The EMS squad is dispatched to a call, one of the worst calls any paramedic could ever think of. Unknown medical aid.
How you doing there, sir? What's been the problem? Can we get the ladder moved in, please? Did you fall off this ladder, sir?
No, dude, I sit underneath ladders all the time.
What's your name?
Billy.
Billy, I'm Alex. I'm a paramedic. I'm here to help you.
That's great.
What's going on today? Yeah, let's hope he's fine.
After arriving on scene, our crew realizes that there may be a mechanism of injury that is significant. But after ruling out altered level of consciousness, neck pain, and any other discomfort, they realize that their C-spine precautions are no longer needed. Now, they find out the patient's name, age, birth date, and after checking their airway, breathing, and circulation, they can move on to the rest of their assessment.
Okay, can I get a rapid trauma assessment from you and also vitals from you, Jonathan, please? Sir, I want to ask you about your arm here. I see that there's some bleeding coming from there. What's going on with that there, sir?
It started bleeding. It started bleeding again once I fell.
What do you mean again?
I cut it in my workshop the other day. No.
Okay, can we take a look at that, please?
Yeah, go ahead. It's not too good looking.
Can I get trauma shares, please?
Any pain when I do this?
No. Hey, man.
Nothing there? No pain?
Hey!
Does this hurt?
No.
So what happened with this injury? You said you cut it the other day?
Yeah, I cut it on a piece of metal in my workshop.
Did you get it treated?
No. No.
Surgical?
No.
I'm going to stick some patches on you.
You just put this on by yourself?
Yeah. Yeah.
Okay. Alright, we got some infection down here, guys. How long ago did you say this happened, sir?
4 or 5 days ago.
Did you get that looked at or treated at the hospital or anything?
Nope.
You're not on any antibiotics or anything?
Nope.
Alright.
After noticing a little bit of heat, redness, and swelling to the patient's injury, the patient obviously has signs of a pretty severe infection in his right arm.
Oh man, I don't feel so good.
What are the vitals there, Jonathan?
Blood pressure is going to be 96 over 62. Looks like he was sinus tach at 122. Sat at 92% on room air. Respirations, I'm putting him at 24. That's where we're at, man.
Now, as you may know, there are many changes that may take place when assessing a patient, and what our subjects have found in our patient may seem to represent septic shock, the tachycardia, the increased respiratory rate, decreased oxygen saturations, and hypotension. But that may not be the case.
I feel like I'm going to throw up.
You okay, Alex?
No.
What's up, man? Hey, boss, how you feeling?
Hey.
Dude.
Sir, can you tell me what's with the black pipe here next to you? What's that pipe to?
What is
that
this?
pipe go to?
It's my exhaust from my shop.
That's venting a piece of machinery?
Yeah.
And so we've got exhaust coming out of that?
Yeah.
Let's get him out to some fresh air, guys.
Let's get you out of here, man.
Okay, let's get him on high flow O2 so they sit him down over here.
Alright, copy that.
Now, as you can tell, maybe judging for yourselves, you can realize that there's a few factors our subjects did not take. Apparently, they did not take a very good look at their scene. because now they realize that there are environmental hazards that may be causing these symptoms in the patient. But there may be something underlying that they need to find pretty fast. And I think sitting back and thinking about it, you might be able to find out for yourself.
So far, guys, what we know is that he has infection, hypotension, tachypnea.
Alright, we got around 10 liters.
Flushed skins, he's hot. And let's see, his pupils, let's go and take a look at that. Sir, I'm going to ask you a couple of yes and no questions for you, okay? Sir, do you have any, just what I want you to do is nod your head yes or shake your head no, okay? Do you have any history of any medical problems at all? No? Are you on any medications? No. Okay. One other question, sir. Do you have any allergies? You do have allergies?
We can shut that down, TKO.
What allergies do you have, sir?
These things. These.
Did you say bee stings? Allergic to bees. Wow, his stats are really dropping. It looks like he's at 84 now.
Shake your head yes or no. Did you feel something stinging behind your ear earlier before you fell? No? Don't try to answer. Just nod. He's got a huge welt over here, guys.
Okay.
It's a little questionable. He's got a stinger in it.
I'm going to get lung sounds here.
Stinger's out.
What do we got on lung sounds?
I got wheezes on all fields. Just going to get a breathing treatment set up. Our updated BP was 88 over 60. Okay, so you're getting the diphenhydramine.
Yeah,
Okay, so we're gonna put this
25
on you, okay?
of diphenhydramine IV.
Just breathe
If
in
we
nice
could
and
get
slow, alright?
0.1 of epi. Oh, you got it, man. Thanks.
Long, deep breaths.
Dude, that blood
There
pressure's
you
so
go.
low.
Very good.
Alright, I'm just gonna give the. Just gonna
Good job.
give 0.1 of this epi. 1 in 10,000.
We got the breathing treatment going too.
Nice deep breaths.
Thankfully, these paramedics were able to recognize some hallmark signs of what they're truly dealing with: anaphylactic shock. Now, there are a few things you need to remember about anaphylactic shock that you may see in your patients: warm, flushed, dry skins, hypotension, decreasing level of consciousness, tachycardia, and what's most important, their wheezes from their lung sounds. Now, had they realized this sooner, they may have been able to avoid some discrepancies that they encountered along the way. Now, hopefully you've been taking notes, and maybe this will help you in your future as a paramedic. Thank you for watching, and we'll see you next time in the Paramedic Zone.
And action!
Wow, that was fast.
Welcome to the new season of Trauma!
Let's do a behind the scenes with Scott Bravo. He's here in the parlor getting all set up for your shot. How are you feeling about this today?
A special thanks for catering.
Did we get any vitals yet?
Patience is the key, my friend.
No, I'm wincing because the sun is right now.
Hey TJ, you're totally sitting on my thumb right now. And...